So now for two questions that we ask all of our podcast guests. The first one is, when you were a kid, what did you imagine growing older would be like?
That's a great question.
Well, that's a tough one.
Oh, wow. I don't know that I ever thought about growing older.
I honestly don't think I thought about it.
Actually, that's a tough question.
Yeah, that's a little bit of a complicated question for me in some ways.
I always, imagine that as I grew older, I would become much more knowledgeable about life and how things worked.
First of all, when I was a kid, there was a group called the Beatles.
Well, when I was younger, I thought the age I am now was so old and that I was done for.
It was a little scary, actually.
I know that, I had grandparents on both sides of my family that lived well into their 90s. And despite seeing some of the challenges of aging through them, they were always fun and active.
The models I had, obviously, were my parents and grandparents. And so I sort of envisioned that. And unfortunately for me, when I was smaller, my parents and my grandparents were very, very active.
I would have liked to have been like my grandfather. He, lived on the ranch, liked to ski.
When I was a little kid, I imagined I was very close to my grandmother, and so I imagined growing old like she did.
My grandmother in particular was, and she still is, a model for me on how to live life to the fullest. She was always laughing. She was always having a good time. She was really the life of every party she was at.
Yeah. And I thought back then, it's such a sedentary, quiet life. You go to weddings, that's where the old people sat in a corner. And now, go to a wedding, what do you see? Who's the first one on the dance floor?
The idea that only teenagers can, grow intellectually and spiritually and is wrong. It's really an opportunity to grasp all of that in your own time of peace and reflection.
A great family, a great support system, they all played a role in my presence here and my opportunity to speak to you about these things.
It is everything that I never would have dreamed about. The life is just ahead of us, and really it's because of the science, it's because of advocates like yourselves that each and every day want more energy put into so that we can live fuller and more complete, healthier lives.
And so what do you enjoy most about growing older now?
What I enjoy most is actually still learning. I call myself a professional student.
Just really being comfortable with who I am personally and professionally.
As you grow older, you have more insights, more wisdom, more knowledge.
I now have the perspective and understand the benefits and acceptance of things the way they are, instead of feeling like I need to fix everything. And what's really surprising to me is I'm still me.
I do find a certain peace from the perspective of what I've been through over my life and what I've lived through, and I appreciate that.
It's just enjoying those little things and making sure to take every day one day at a time, rather than being so focused on things that in the grand scheme of things really aren't that important.
I think of growing old as being on the vanguard, right? Because really what we're trying to do now is to push the boundaries of life expectancy. We are trying to move that frontier, not just for ourselves, but for the next generation.
As we get older, the way I've heard lots of women express it is that we give fewer Fs. That's true. I am much less concerned with conforming to some role that society has for me.
Well, it's funny, when I thought about this, I know I've heard you say this, I've heard other guests say this, But even though there's still plenty of surprises and mysteries ahead, there's a certain sort of confidence and understanding that comes with age. And we don't have to worry as much about the small stuff, although I certainly still worry. But we can focus on the things that matter to us and our families a little bit more than we were younger. And so I'm trying to pass that on to my kiddos with the hopes that they can have some of that knowledge when they're still young, because I feel like if they can be young and have all that wisdom, that's just an incredible combination. So not that I have all the wisdom, but I think we just learn not to sweat the small stuff.
Hi, I'm Lindsay Clark. I'm the Senior Vice President of Health Education and Advocacy at the Alliance, and I lead all of our efforts to educate and empower consumers, patients, and caregivers.
Hi, I'm Beth Bradshaw. I'm the Vice President for Patient Engagement and Research at the Alliance for Aging Research. One of my main responsibilities is the Talk Nerdy to Me program, but I also work on policy and assist with other training initiatives as needed throughout the Alliance.
I'm Sarah Delgado, and I serve as Vice President of Development at the Alliance for Aging Research. At work, I've been with the Alliance for over 8 years, and I oversee all of our fundraising efforts, but more specifically, our corporate partnerships.
My name is Michael Ward, and I'm the Vice President of Public Policy and Government Relations. I love the opportunities that my work at the Alliance provides me to go deep into the nuance of science and regulatory policy, while also giving me the chance to work with really smart people on Capitol Hill and in the patient advocacy community to figure out how to get things done and improve the lives of older adults.
So I guess I have to say that my favorite project that I worked on this past year has got to be Valve Disease Day. We celebrated our 6th year of this international awareness campaign, and it's always such a pleasure to be joined by so many incredible partners, 118 and counting, that all come together to raise awareness about a disease that impacts more than 11 million Americans, but that most people don't know about. We get to work together on virtual conferences, social media campaigns, op-eds, radio media tours, and so much more, and it's really rewarding to see what an impact we can have when we combine our efforts.
I've got to go with the Alzheimer's Disease Policy Task Force. It was an amazing opportunity to work with so many patients and family caregivers that are living through this insidious disease right now. Our work was so enriched by their presence, their contributions, and their willingness to jump wholeheartedly into advocacy. I loved working with these powerful patients to meet multiple times with CMS and CMS Administrator, HHS Secretary Becerra, and raise the need for access to the White House Deputy Chief of Staff and Domestic Policy Council.
I was hired recently primarily because I've worked on the Talk Nerdy to Me clinical training program previously as a consultant. And we are in our 6th year of that project. It is, my favorite. It's the one I know the most about. And it's something that I'm very excited about. It's really proven itself to be useful within the advocacy community, and it has evolved over time. It's gotten better. It went from a in-person training, and then in COVID, we went to virtual and Zoom. And we've gotten a lot of positive feedback on this program, and we hope moving forward, we're going to really look at it strategically, see what gaps are out there within the advocacy community and training, see what we would like to have this program be over the next 5 years. So we are going to finish up our last PCORI funded training at the end of October, and then do some strategic analysis on how we want to move forward.
My favorite project has actually been working on our 2022 Heroes in Health celebration. As you all know, we've been in a bit of a pandemic the last few years, so we haven't been able to hold this important event in person since 2019. This event includes our 29th annual Bipartisan Congressional Awards Dinner, which brings together honorees that have done amazing things for folks as they get older, as well as bringing together all of our supporters and friends. And I'm just so excited that we could be back together this year.
I love being able to empower people to take charge of their health and to get the resources and care that they need. I get to create resources that can help people as they face new diagnoses and new health challenges. And having watched many people I love navigate through their care, I know how important it is. Plus, we're all aging, so what we do is relevant to everyone.
I'm passionate about working on aging issues because if we're blessed to get there, it's something that's going to happen to all of us. And I think we can all relate to having older parents and grandparents age, and watching them age with dignity and health is something that I think we can all agree is very important.
I've had a long, varied experience with being interested in advocacy within the aging population. I worked for several local dementia programs as support staff, as a volunteer to give people time away, caregivers time away. I think aging is a really important process that we hope we all get the opportunity to do. The over 65 population is often one that is overlooked and minimized in the United States, and I think it's really important that as we age and as we have greater numbers of people aging within the United States, that we think about the best ways to improve quality of life for that population. So I'm very excited about that.
The topic of growing older can be a bit like some of the other big philosophical questions about life, where the majority of people don't really want to think about it until it's directly impacting them, or are even in denial they are growing older when, in fact, they are. However, if we are all fortunate, we will all live to experience the fullness of being able to look back on a life that is already full of meaning, but where we still have the ability and the time to contribute to our families and to our communities. I love being able to work on policy issues that help ensure people are healthy and able to make a difference as they grow older, both for the current generation and, God willing, for myself and my family in years to come.